All ready? Good afternoon. Today we know across the state of Washington we have so many families that are hurting because of these fires. Families have lost their homes, lost their dreams. And I know all Washingtonians would like to wrap our arms around these folks and show them how much we care. And Trudy and I feel that same way, and that's why the other morning before I went to Eastern Washington, Trudy and I picked some apples off our tree at the Capitol residence to take as a gesture to the people to let them know in Bridgeport, Malden, that they're not alone. And obviously, we regret that mistake, and we hope people's awareness of this situation is raised by this. It is in that spirit that moved us in the first place. We'll be making contributions to local food banks in 3 counties. And I want to thank all the Washingtonians who are chipping in. The generosity has been quite remarkable. I talked to the Red Cross this morning, and we're seeing great acts of kindness, and we appreciate what everybody's doing in the state to help Washingtonians through this difficult time. This morning, I want to start by congratulating Bob Ferguson and his team for another victory for democracy in the state of Washington. Today, a federal judge ordered the U.S. Postal Service to stop any changes that could slow election mail across the country. We are joined by 13 other states in this crucial move to defend American democracy. And obviously, we have led in good, effective, safe mail-in voting in Washington state, and we hope other states follow our lead. This is a major win for democracy. We are confident in our elections, and we know this is going to add to that confidence by preventing the Trump administration from slowing down the mail and thereby reducing the effectiveness of our democratic voting system. I'm happy to say in our fires that most have been contained at the moment. We want to thank our firefighters and first responders for their heroic work, and it has been heroic. These folks doing this work in this smoke and heat, it's unbelievable how they do it. And we're grateful that at the moment there have not been significant, as I understand, injuries on the fire line, and that's a tribute to the training and the leadership in our personnel. I spoke to British Columbia Premier John Horgan today, and I am so appreciative to hear from him that British Columbia is, in a sense, contributing 200 firefighters. They'll be trained in Redmond, Oregon. They'll be available to fight fires up and down the West Coast. And he told me that when they asked for volunteers, they needed 200, 800 signed up. So this shows a fantastic spirit of our friends to the north. I also read about a family whose home was saved by a drop of retardant that came from Canada across into our airspace, saved a home up in Ferry County, and then returned to Canada. That's a good neighbor, and we'll be thanking British Columbia for a long time for their efforts on these fires. We will respond in kind as needed, of course. I'd also, to help Washingtonians, I directed the Department of Social and Health Services to update its disaster cash assistance program to serve people who've been affected by the wildfires burning throughout the state. You can visit WashingtonConnection.org, WashingtonConnection.org, to see if you qualify for food, cash, child care, long-term care, and Medicare savings programs, or to find other services. You can also call DSHS's Customer Service Contact Center. The name is on the screen, or the number is on the screen. These are folks who've lost everything. This immediate cash is helpful. We're hopeful to get it to people. I hope people will share that information. I spoke to the mayor of Bridgeport today, and she's going to help get this word out as well. By the way, we're pleased that the Bridgeport has been able to get potable water going again. I met with her when I was in Bridgeport the other day, and her water quality folks, and I'm glad that they have been able to make progress on that. So While we're doing what we can at the state level, we've also asked the federal government to pitch in. We've asked FEMA and the Trump administration for a federal major disaster declaration due to the extensive damage caused by fires in the state of Washington. And I am specifically requesting FEMA provide individual and public assistance for Whitman County declarations, including sheltering for those displaced by evacuations. We will be requesting public assistance for additional counties, we hope, in the coming weeks when we're able to conduct the necessary damage assessments. Right now, conditions remain inaccessible and unsafe to do those assessments in counties other than Whitman. If these assessments are able to be completed, other counties may be included. I'm really hopeful that the federal government will come through this time for Washingtonians who have lost so much. Now, I know that we are all feeling the problem of the smoke and the terrible air quality which we've had over the last several days. We know that bad air quality makes everything tougher when you can't go outside for fresh air exercise. And we know we all feel this sort of dark, oppressive cloud about 1.5 inches over our heads. We all feel that. A lot of people I've spoken to in the last few days have shared how that impacts how they feel, their mental health, not just their physical health. And we know Washingtonians have been going through some rough times that put stress on us all. COVID has been with us for more than 6 months. We know that that is an impact on our mental health. And we also know that it's normal not to feel okay during a pandemic, much less fires. So this is really tough. And we know that anyone can experience these impacts, regardless of race or gender, politics, or religion. It's normal to feel abnormal, as I guess what I'm saying. And I know a lot of people are struggling and have had a hard time over the past few months. So the ongoing pandemic, the historic protests for change, the wildfires, the bad air quality, the loss of our loved ones, people are fighting for their lives, their livelihoods, and their homes. It's a lot to take in, and that's tough. Mental health is physical health, and it's just as important to look out for signs and symptoms of emotional distress in ourselves as we do regarding ailments and injury. So we have brought some experts today to talk about how to protect ourselves and our loved ones through these difficult times with mental health challenges. And I think in talking to these experts, what I have told over and over again is we need to learn how to recognize when you or someone in your life needs some emotional support and how they can ask for that help and how they can connect with it. We just got to realize seeking help is not only okay, it's great for us and our loved ones. And supporting each other to seek help is something we can all do for each other. Changes in our feelings, our thoughts, behaviors are common and normal responses during this kind of time. I'm told the Department of Health says that upwards of 3 million Washingtonians will likely experience clinically significant behavioral health symptoms during these times. This is normal. It is not a result of weakness or doing anything wrong in any way. Any of us can be affected, and we've all got to figure out how to support our family and our friends and our coworkers and our neighbors in that regard. We know that behavioral health impacts are exacerbated in so many different ways, and that people will increase their use of alcohol, drugs, and other forms of self-medication at times like this. So if you're experiencing stress because of COVID-19 or because of the fires or whatever, you can reach Washington Listens at 833-681-0211. That's a good number to know. And if you're in crisis and need help right now, and I'm very serious about this, if you feel you need help right now, please call 866-4-CRISIS, 866-4-CRISIS. or text HOME at 741-741. HOME at 741-741. We also have the National Suicide Prevention Lifeline, 800-273-8255. We have more help and resources available at coronavirus.wa.gov/wellbeing. Any and all of these ought to be able to help, and you're doing the right thing for yourself and your loved one if you consider getting help, if you think it makes sense. So to talk more about these resources and when we ought to think about using them, we brought some guests who really are experts in this regard, who can help people who are experiencing them. We're joined by Dr. Kira Moseth. She is the co-lead of the Behavioral Health Strike Team, Washington State Department of Health. Mario Paredes, Executive Director, Consejo Counseling and Referral Service. Yoonju Han, Behavioral Health Director, Asian Counseling and Referral Service. And Lily McGregor, who's a student at La Crosse High School in Whitman County. So if we can start with Dr. Moseth. Thanks for joining us.
Thank you, Governor. I appreciate it. I'm here to share with you all a little bit about what's going on commonly with some of our behavioral health experiences in the context of COVID and how we can sort of work on navigating those things. You may have noticed that in recent days or weeks or months that you've been a little bit more forgetful than normal, or that you have trouble tracking details, or when you're talking to work colleagues that people are getting kind of just forgetful in general and maybe more distracted than they normally would be and having trouble focusing. All of these are known cognitive and neurological effects from being part of a disaster experience for the last 6 months that we've all been exposed to. They're very normal. Our brains respond to disasters in very predictable ways. You also may have noticed that people are a little bit more quick to anger, maybe a little bit more apt to respond quickly emotionally to things that otherwise wouldn't have previously bothered them. You might see this again with work colleagues, at home with your family and your kids, or even at the grocery store or the gas station. So people are just a little bit more keyed up right now, and that's a known factor in where we are in the disaster response cycle. So for Washington State, what we're looking at is for the next quarter, the fourth quarter of 2020, we're headed into what's called the disillusionment phase of disaster response. There's a chart available that can sort of map what we know about behavioral health symptoms with regard to how people tend to respond and where Washington is currently and where we can expect to go. So if you look at the chart here, you'll see that for Washington, based on our time frame, impact phase was approximately mid-March. Then we proceeded into the heroic and honeymoon phase, which was about late April, early May for most of us. And then here we go down into the disillusionment phase. And that's a little bit of it's a challenging term, but we know this is based on disaster science from a variety of incidents all over the world and in the United States, including 9/11 and Hurricane Katrina, as well as smaller scale incidents throughout the country. So the period that's 6 to 9 months post-impact from a disaster is typically the hardest time for people. And it's because we really struggle with that coming to terms, that acceptance of what new normal is going to look like. And there's a lot of information we don't have, right, about how that's going to go. But the most important things to keep in mind is that struggle and that sort of acceptance of what it's going to be like in the next 3 to 4 months and dealing with the unknowns is part of the common experience, and not a single brain is immune to that. All of us are in that together. So we all are experiencing some of these symptoms, and some folks to a greater degree than others, right? And so I really appreciate the governor's remarks about keeping an eye out for your friends and family and people who might need a little bit more help or professional assistance or support, because that's going to really help us get through. As we head into this disillusionment phase for the later half of 2020, unfortunately for Washington, it kind of coincides with some other things that are going on, like seasonal affective issues when the weather changes. So the smoke is not helping that, obviously, right now. And the conditions of daylight have changed, and the weather just kind of worsens in general, so people are inside more. We don't know what's going to happen with regard to a second potential wave of illness in the fall. But we do know that we can get out ahead of the behavioral health issues, so the depression and the sense of hopelessness. We can get out in front of that by promoting the active development of resilience. That can occur individually, that can occur within our families and our communities, and within organizations and companies. And ingredients is created by looking at 4 different ingredients. So you have hope, connection with other people, That includes maintaining existing connections and developing new ones in this virtual world that we're living in. And then redefining and establishing purpose. So identifying what motivates you on a daily or a weekly basis. What's really going on that gets you out of bed in the morning? And it's probably going to be different than it was in January or February of this year. And that's normal too. Really accepting that that's the way it is. And then the last ingredient there is flexibility and adaptability. And a little bit of that is required from all of us right now to sort of get through this next phase, but we can. The data show and are clear that resilience is by far the most common outcome to disasters, and that most people will return to their baseline level of functioning within about 12 to 16 months. The data for Washington State really support this pattern that I was just mentioning and the sort of predictable routine about how people respond from a behavioral health perspective. And that includes the substance use data, that includes depression, that includes anxiety that we've been paying attention to and tracking through the DOH now for a number of months. So all of this is just to say that these experiences are very normal. Resilience is a common outcome. And we can build it intentionally. We can go about having some empowerment there about how we go about doing that. So I would encourage everyone to focus on that and certainly reach out for the resources if they're needed. There is professional support. There are therapy services through either insurance or EAP or community mental health organizations. So lots of options for you. And the Washington Listens line is a great resource, as well as the other crisis lines that were already listed here today.
Thank you, Doctor. I thought that you're empowering Washingtonians to take control of our destiny. Thank you. That's a great message. Mario Paradas, Executive Director, Consejo Counseling and Referral Service. Thank you, Mario. Take it away.
Yes. I'm here to share with every Washingtonian that we have services available. If you are experiencing behavioral health symptoms, behavioral health conditions, if you're having suicidal thoughts, if you're feeling alone, if you're feeling isolated, if you're suffering from anxiety, depression, please know that every community has behavioral health centers that can help you. It's as simple as picking up the phone and receiving help. There are services in every region, and in every region we can offer mental health assessment, psychiatric evaluation, drug and alcohol treatment. This pandemic has brought many challenges to our communities. One of the challenges is that for children, it removed them from their regular environment, and now children are spending more time at their home and their computer. By doing that, they have lost all the socialization connection that they used to have at the schools. This has created a lot of children's behavioral issues. Parents are now having to be teachers, and they're now having to be parents at the same time. This has affected their employment, this has affected their work, and this has affected their ability to parent. All of these challenges bring a lot of stresses in the person's life. We have seen an increase of number of domestic violence cases during this pandemic. We have also seen an increase of number of substance abuse cases in driving under influence fatalities. So it's very important to know that you need to recognize the symptoms. If you begin to acknowledge that there are symptoms that are affecting your daily life, which could be excess of use of alcohol, using alcohol or drug as a coping mechanism. You're seeing anger outbursts. You're seeing domestic violence. You're seeing that there is more tension between children and parents. Please seek help. There is help available. You can call to every center has a crisis line. Every region has a crisis line that will be able to provide those services to you. At Consejo, we specialize in serving King, Pierce, Tucson, Mason County. We're available for you. One of the things that is very important is that during this pandemic, the number of suicidal thoughts among the youth population has increased significantly. The number of depression has also increased. We're going through the last phase, in the phase where we're going to begin to see an increase of number of behavioral health cases. I'm highly encourage you to seek help. There are help available for, you don't have to be Medicaid. You can receive services if you're Medicaid or non-Medicaid client. The doors are open for all of you. Just pick up the phone, call, we're here to help you.
Thank you, Mario. Thanks for your offer of that help. Yunju Han, Behavioral Health Director, Asian Counseling and Referral Service.
Thank you, Governor. Our agency serves Asian Pacific Islander immigrants and refugee community members living with a mental illness. Asian Pacific Islander communities are extremely diverse, and each ethnic group's needs and experience are very different. I want to send you a message that mental illness is something that we can manage. Mental illness or mental health is biopsychosocial disease, and socioeconomic and environmental factors makes our clients even more vulnerable because our clients have, in addition to mental illness, many people live in poverty, many have language and cultural barriers to access resources, and many suffer also from physical health issue. This pandemic and Black Lives Matter movement and recent wildfire is impacting all of us. Our community members are experiencing emotional distress from fear, uncertainty, and stress. Many people report anxiety and depression, along with, again, increased domestic violence and substance use. Existing mental health condition is worsened by enormous stress and secondary trauma and racism against Asian Pacific Islanders. Many isolated clients are at a greater risk, and they do not have access to food, medication, health information, and social support. Many of our clients live in a very crowded housing condition, and many of their family members are low-wage frontline workers. We've noticed that Pacific Islander and certain ethnic groups such as Mien, Cambodians, Burmese suffer more from COVID-19 virus. Many of our clients do not have phone, computer, access to internet, digital literacy, nor a safe and private place to be engaged in a telehealth. In spite of all these challenges, I believe that there is a help and we are all willing to work together. We believe that everyone who needs mental health service should have access to mental health care without any barriers and stigma. We need to desegregate data and develop strategies for diverse Asian Pacific Islander community and other minority community. Mental health service should be holistic to treat the whole personal health. And service should be provided in a language and a manner that they can understand in their cultural norm. As Mario says, we are in a very rich state where many services in different language and different cultural approach are available. The best thing that we can do is be aware of all the challenges that we are experiencing and seek out for help. Just like physical health, when you have a mental health issues or challenges, seek out and ask for help. And I believe that we have a lot of resources that we can help each other in the community. Thank you.
Thank you so much. And we have Lily McGregor, who's at La Crosse High School in Whitman County. Lillian, thanks for joining us.
Thank you for hosting this. And I would like to share that mental health is not only, the mental health issues faced from COVID-19 are not only affecting the adults in our community, but also the younger children, especially ones who receive all of their counseling from schools. Many think that our counseling problems can be solved by the use of telemedicine and sessions over Zoom. However, it has been shown through surveys that only 58% of rural residents say that access to high-speed internet is a problem in their area. So this solution of using telemedicine and connecting with people over the internet will not always work. On top of that, the mental health problems of people during this time are being very exacerbated by the unique combination of a public health crisis, social isolation, economic recession, and fire threats all at the same time. So we're seeing some very unique changes from that. It is predicted in Washington that the highest risk of suicide will likely occur between October to December of 2020 this year. And family members and friends should be on high alert and watching for symptoms of depression, such as little interest or pleasure in doing things that a person used to enjoy, feelings of hopelessness, poor appetite, suicidal thoughts and actions. And if you or someone that you care about starts exhibiting these traits, please call the National Suicide Lifeline at 800-273-8255.
Lillian, thank you. You give us inspiration. Your age group's leading the state. I really appreciate your leadership on this. And by the way, if you know any students at Whitman, as they return, I hope you remind them that we need their help to prevent transmission of this COVID too. So you got to be really careful about that excess party. And I bet you can help me, right? Oh, we might have lost Lillian. I'll see you at her graduation, I hope. One of the take-home messages I have from these experts is a good news story, which is that we can affect our mental health. It is in our power to do that, and it's very normal what we're all experiencing right now. That's good news. So I hope people can continue to help themselves and each other as we move forward on this. There's another thing we need young people's help on, and that is that we unfortunately are seeing significant growth of the COVID pandemic on college campuses. There has been an enormous spike, as we understand, at Pullman. So yesterday I had a good conversation with some of our college leaders, both students and administration, as well as some of our police folks. And I'm encouraged by the leadership across our state on this subject of all ages, people who are actively working to keep our students safe. Because when we keep our students safe, we also keep the community safe. Talking to the police chief and President Schultz and the students in Pullman, we really care about those Cougar students. But we understand when they keep themselves becoming infected, they then don't turn around and infect other people in the Pullman community or when they go home to their families. So we all have a stake of what's happening as our students return. And what we've learned is that even though these students are receiving an on-site or an off-site education, when they are congregating off the campus, that's where we're seeing big transmission. So we are hopeful that the student body leaders will be successful in their initiatives. We saw some really aggressive initiatives in the Cougar student body population. And we talked yesterday about how to expand that statewide. And my staff will be working with some of these student body groups to design, to listen to their leadership about how to design a communication strategy to help keep people safe. In other COVID news, yesterday we joined California and Oregon in announcing that our 3 states will be using an app that Google and Apple jointly developed for notification of your exposure to COVID. It's really important to realize this is a voluntary app. It will anonymously notify a user who has been in close contact with another user who tests positive for COVID-19. This will not keep people from catching the virus, obviously, but it will let them know if they have been exposed and therefore need to get tested. I want to repeat, this is a voluntary thing on both sides. You volunteer to share your information if you desire with the app, and you volunteer to be notified should you desire of that. And all of this is maintained with great privacy protections. We've insisted on that. We know that this smoke has been unhealthy for so many in the state of Washington, particularly those who work outside of many industries. And I'm thinking right now of the agricultural workers who have been working in very difficult conditions to keep us fed and nutrition on our tables. We're working to keep those workers safe. To that end, we have provided about 1,250,000 masks to our farm workers. And that has included, from the smoke standpoint, nearly 500,000 KN95s for fire and smoke. That's so far. This is important work. There will be further transfer of these to farm workers. I think it's about 25,000 in the next week. These folks deserve protection. This is important joint effort between our offices, agencies, nonprofit community organizations, and agricultural associations. We're also looking at potential emergency rules in the short term. We don't know if we could get them in place before the smoke is gone, but we're definitely considering rules for the long term, considering that we have to realize that the frequency of these fires causing this smoke is going to increase with changing climate. So we'll be looking in the next few weeks at changes in the rules that would set potentially a requirement that employees working outside under certain conditions would be provided with effective masks. With that, I'm happy to stand for questions. We've gone on long today, so we may not get to everybody, but happy to stand for questions.
First question comes from Joe with the Seattle Times. Joe, are you there?
Yeah, sorry about that. Governor, given the outbreaks not only in Pullman, but at college campuses around the nation, how can you feel confident that students will self-monitor or self-enforce stringently enough to tamp down on outbreaks there? And do you think there's any more moves that you think the university should be taking?
Well, first off, we know what the most effective thing is for people in general, and certainly for people of this age group, and that's peer influence, peer pressure, peer communication. We need young people to influence other young people to help and to be responsible in this regard. And that's why we're pleased that the student body associations that I talked to yesterday I believe will be aggressive on this. I believe they'll be comprehensive. I think they'll be smart with their messaging. And they have targeted messages that people respond to. I saw a couple signs on the Pullman campus. You know, it said, COVID sucks. People understand that language. Another sign said, don't be a COVID-idiot. So that's the most powerful, effective technique to change behavior. But there are student conduct issues in Pullman. If you do receive, I'm told if you do receive a citation from the Pullman Police, that is something that's referred to the Student Conduct Association, and the Student Conduct Board could take some sanction or educational policy to help the student become positive. The Pullman Police are issuing financial citations, not criminal citations, but financial citations. And the Pullman City Council just included the potential that party goers, not just the person who held the party, could also be responsible for that. That could happen in other communities. Those are decisions that we made by the local communities. All of those are important. I'll mention one other group that I think is important, and that is we parents and grandparents. I think we can be helpful in this regard too. You know, a lot of parents are shelling out money for tuition right now, and we'd like to keep these kids healthy if they're going to go to school. I encourage parents and grandparents and uncles and aunts to have some conversation with their students for their benefit and their parents and grandparents' benefits and their community benefits. And if we all pitch in, I think we can influence this, because I want to reiterate, this is a nightmare for us. Look, we had like 800, 900 cases in Pullman. Just blew up. We just can't have that happening around the state of Washington as people return to Bellingham and Ellensburg and Vancouver and other places. So I hope everybody's going to pitch in on this.
Next question comes from Essex with Cairo. Essex, are you there? Go back to Essex. Next question will come from Jim with the Spokesman Review.
Governor, the House Labor Committee got a report on the unemployment trust fund this week, and I'm wondering, it's half of what it was before the pandemic started. I'm wondering, would you support using some of the state's CARES funding to backfill the unemployment trust fund, which could be so low by December that they'd have to seek a federal loan to keep it in good shape?
I haven't thought seriously about that. I doubt it. And the reason is that, first off, we are very healthy relative to other states. We have a very large trust fund relative to other states. We're fortunate in that regard. This borrowing is frankly not an extraordinary event. Many states have done it and will do it throughout this circumstance. So it really does not affect really adversely our situation. So I doubt it, because we have so many other claims on the CARES funding, from homelessness to provide, you know, mental health services for people, to help small businesses right now stay open. So I doubt that would be an appropriate use or necessary use of those funds at the moment.
We'll go back and try Essex again. Essex with Cairo, you are unmuted. Essex, are you there?
Essex, if you can email your,
Are you hearing me now?
yeah, go ahead, Essex.
Okay, thank you very much. Thank you for your patience. Governor, how do you react when you hear the U.S. Attorney General Bill Barr liken the COVID safety lockdowns that you've ordered to slavery?
I'm trying to moderate my answer to be civil, and it's a challenge. The things we're doing are saving lives in the hundreds of thousands. It is difficult for me to understand how anyone, Attorney General or otherwise, would look at that as a reprehensible stain on our country as slavery was. It's very difficult for me to understand that, except for people who want to try to, make this an electoral issue. I find that really disturbing, wrong-headed, and unfortunately dangerous. And I just want to come back to that dangerous part. This isn't not an issue of offended sensibilities. It's not a matter of not showing proper etiquette. It is enraging because it endangers people's lives. That's what's at stake here, not our feelings, not our, bank account, our lives. And when this administration and Mr. Barr essentially try to convince people that this is a hoax, that it's just going to go away, that it's on its own, that we're going to have a vaccine next Thursday, that masks really aren't that important, that endangers Washingtonians' lives. And that's not acceptable to me. And it's going on across this country. And Mr. Barr is not the only person who's trying to convince people that wearing masks somehow is a communist plot. And Republican and Democratic governors alike are helping their constituents to mask up. Dr. Redfield, the CDC leader in the Trump administration, hired by Donald Trump yesterday, said that masks could be as effective or as helpful as vaccines. That's an important statement. And to have the Attorney General try to undercut that effectively is stunningly dangerous, not just offensive. We could get away with offensiveness. We should not accept danger. And that's what this is. So I've tried to be civil in my comments. And by the way, I'm happy to wait for your question, Essex. Anybody who's been at this for 38 years deserves to wait a little bit.
Next question comes from Jerry with the Everett Herald.
Governor, starting Monday, the Employment Security Department is planning to process and start paying out some added benefits under the Lost Wages Assistance Program. Earlier this year, the department had some troubles getting workers their benefits. What have you done to assure eligible workers will get their benefits in a timely manner this time?
Well, I was briefed this morning about that by the director, and I'm really pleased that we think by end of September that queue will be back into a normal setting. As you know, we've been working diligently to get that down as fast as humanly possible. And we think going forward, there will be a relatively more normal time period because, as you know, there was such a deluge of 10 times as many claims that this organization was set up to handle. And now that we've got that back down and hope to have that down to the appropriate level by the end of this month, it should be a relatively normal time period. I'm also pleased, I believe, and you should seek confirmation of this, that today we were told we will have, it's either 5 or 6 weeks, I think has been confirmed, which we're happy about, of these additional benefits, and we're really happy about that.
Yeah, so obviously Spokane County out here, we're still in phase 2, and it seems like for a lot of businesses, the concern is as much not knowing as anything else. With Safe Start, they could at least make some long-term plans. Now with the pause, that's not really as possible. So I'm wondering what kind of metrics are you monitoring? What might it take to start to reevaluate that pause?
You bet. Look, we are eager to try to make advances in our reopening of our businesses. The uncertainty that these business owners and their employees have is terribly painful for them. I feel it, I share it, I know it's across the state of Washington. And I think you put your finger on really something that's the uncertainty about this that is maybe as frustrating as anything else in this situation. So what we're doing is trying to be as effective as possible to drive both the number of our cases down. We're shooting for 25 per 1,000, and the positivity down, and the R0 number down, which is the number of people you're infected that one person affects. To get all those three numbers down to a level where we believe we can keep them down. We're a ways away from those right now. There has been some recent progress, as you know, in the number of cases. That has come down. We're very pleased by that. Now I think we're about in the top best 8 states in the United States on that metric. The positivity metric has been a little improved, but it's sort of plateaued the last, week or so, at least according to my review. The R0 number we think might have been below 1, but might be a little above it now, still hovering around 1. We've got to get that number down. So those are probably the hospitalization, obviously, rates are obviously important, and the deaths are our ultimate arbiter of this. Although the deaths, because they lag so far behind the infection, the hospitalization rate is probably more important in our assessment vehicle. Now, the reason I mention this is that our ability to open these businesses is dependent on reducing the rate of infection. And we have an extremely powerful tool, we believe, to do that, and that's these masks. And if we want to open up our businesses, the more people that wear masks, the faster we're going to open up our businesses. That's just a lead pipe fact. And it's another reason that I hope we will continue to have great compliance with the mask requirement. And I will tell you that it is greater than it was a month ago. And I would just, if I can, just take a moment why I say this. We had a huge need to mask up a month or two ago. And as a result, and there's pretty good evidence of this, we have driven some of these numbers down. But it's probably more important in the next 2 months, because this is when people are going to come back inside in the fall. They are going to be in contact closer inside than outside. We know inside is much more dangerous than outside. And if we let our guard down and start going to family dinners with several people in the same room not wearing masks and they're sitting next to each other, this is just a recipe for disaster, and we'll be right back in the soup. Europe is now experiencing this. This morning's news out of Europe is that there has been several really concerning spikes in Europe. They got their numbers way down, lower than ours, but now they're coming back up. And we have to realize the next month or two is very challenging for us in this regard. And I wish I could say that we'll have a vaccine before the election day. I know the president will announce that. You can almost be assured that he will announce a vaccine, even though we don't have one. We gotta stick to what we know works right now that we have, which is masking and social distancing. So we're gonna be talking to our Department of Health and their experts about how to help people be safe in the fall. How do you be safe inside? How do you have some social interaction in a way that does not increase this pandemic? And we'll be sharing those messages with the public as we work on this.
Alexis with the News Tribune.
Governor, I'm wondering if you can talk about the accessibility of telehealth opportunities with mental health providers. I'm wondering if those appointments are available and affordable in our state, and what the state can do to support those efforts in places where there might not be.
Well, we have passed some laws to make sure that telehealth can be paid for by insurance companies, and that's really a good thing. But I'm wondering if I can have Dr. Mosseth talk about that in any more detail. Doctor, do you want to talk about that at all?
Sure, I can give it a shot. So telehealth, yeah, you're right. You're absolutely right, and that's how most of us are operating in terms of psychotherapy right now. And insurance does work with us very well, hand in glove, to make sure that our patients have had continuity of care throughout this COVID incident. And the issue of, internet access is something that I know that agencies throughout the state of Washington have been working on to make sure that rural areas are, like Lillian was mentioning earlier, have the access to get people the support that they need if they're not able to see providers in person. So most of the providers that I know and work with are using telehealth effectively. They're able to maintain continuity for their patients, and that's worked fairly, seamlessly as much as it can with insurance and with billing and payment and that kind of thing. So it hasn't really stopped the flow in terms of the services that people are able to provide.
Any of the other speakers want to add to that? Anything? Okay, great.
Anna, are you there? Try her again. Next question will come from Bridget with the Wenatchee World.
Hi, Governor. Yeah, you kind of touched a little bit earlier on about the apples that were brought to Douglas and Okanagan counties. I was wondering just kind of your reaction to the apple maggots that were found there, and what your office is kind of doing to try to recover those apples.
Yeah, well, obviously, we would not want those to have arrived in Douglas County. I think you probably understand this is an act of attempted generosity that didn't work out that well. And I tell you, I see these people in pain. I see them crying, standing in the ashes of their home, and you just want to do something to show that you can let them know they're not alone. And Trudy and I just figured that morning that if we could pick some apples that morning off our tree and deliver them, maybe that's a little small gesture to let them know they're not alone. So that's what we did. And fortunately, I'm told that the vast majority of these have been recovered. We had a box in Malden that has been recovered by our state Department of Agriculture. There was a kind of a tray that I left at Bridgeport at a church that was a center of food delivery. That has been recovered. And there was a bag of 7 apples I left for a great old rancher at a retirement center in Omak that's been retrieved. So I'm really glad that that's the case.
Try Anna with KUOW again. Anna, you are unmuted.
Hi there, can you hear me now?
Yes.
Excellent. So apart from the Washington Listens line, do you have any plans to invest in any additional programs or new funding for, say, long-term mental health services for the fall or winter? For example, to support organizations or healthcare providers who are supporting community mental health needs?
Well, there is a potential of additional CARES dollars as those are becoming scarce, of course. So that remains a possibility. We, of course, talked to legislators about those things in making those decisions. So we have not had those conversations yet, but that is a possibility. Our message today, though, is we need people to ask, and we hope people will do that. And fortunately, because of a law we passed, the insurance companies are required to cover these mental health services. So for those who do have insurance, and I'm glad that because of our efforts, we have added 800,000 people who have insurance, that people will seek this treatment and the insurance policies can cover it. Now, we are disturbed that the president is trying to take away that health insurance for people with mental health from 800,000 people in our state. So far, he has failed, and we will continue to hope that he continues to fail because we need these services right now desperately. And I hope people will continue to access them.
Time for a few more questions. We have time for one more question. It'll come from Scott with Northwest News Network.
Hi, Governor. Can you clarify, I think you said it at the top, but just to clarify for the record, did the apples that you brought all come from the Capitol grounds and the governor's mansion there? I've seen some speculation that they also might have come from your home in Bainbridge Island. And can you just clarify, were you aware of the quarantine issue before this?
Well, they came from a tree that's on our grounds. It's a tree that we planted a few years ago. It's very productive. And look, I was thinking about the people who lost their homes, and we went too fast. And I regret that. And I hope it's a lesson for folks. And now we got to focus how we help these people. And we're doing that. This is not related to that other issue, but we had a delivery of tens of thousands of pounds of food from our Department of Agriculture that the Red Cross told me that's been really efficient, and I'm very happy about that recently. So I regret this happening, but I want people to know I care about them.
Final words, Governor?
No, I want to thank everybody. Please be safe. And I know these are hard times. This smoke is really tough on us. But if we watch out for each other and if we watch out for ourselves and care for our mental health, we're going to get through this together. Thanks a lot.